Welcome, everybody. Thank you for joining us here at Rockefeller Institute for our 2021 Local Government Lab. We're going to wait just a couple of minutes while people log on, and then we'll get started. All right, well, hello and welcome again to the Rockefeller Institute's 2021 Local Government Lab. It's a forum that we put together for New York State researchers, practitioners, and policymakers to examine innovations and best practices in local governance. My name is Brian Backstrom, and I'm the Director of Education Policy Research Studies here at the Rockefeller Institute, and I will be your moderator. This is panel 6, our last panel of the day, Education Leadership, Advocacy, and Change. And this session will feature the following 5 presentations. COVID-19, a cross-sectional study analyzing healthcare students' perception of life during the pandemic. And that will be presented by Laura Geer and Rachel Radigan. The role of local government in federal-state partnerships for higher education, presented by Rebecca Natow. What we can learn about school leadership and special education representation from the New York City Teacher Survey, presented by Renee Parmar. Statewide advocacy for legislative change for a profession, presented by Deborah Napolitano and Julia Donnaruma. And finally, hidden transcripts, how local officials perceive state school consolidation and municipal restructuring efforts. And that's presented by Casey Jakubowski. So today's been a day full of virtual sessions. So we'll try to stick to the 15-minute time limit per presentation. And after this session's panelists have concluded their presentations, there will be a Q&A session, probably about 20 to 30 minutes. So audience members, please submit your questions using the Q&A function. And you can find that on the bottom of your Zoom toolbar or taskbar screen. And you can access the taskbar by just hovering your mouse over the screen, select the Q&A function and type in your question. And before we begin, I do want to say thank you to all of our panelists for taking the time to share their research and their experience as part of today's forum. And we really look forward to these presentations. With that, I'll hand it off to our first presenters. Laura Geer and Rachel Radigan are of SUNY Downstate Health Sciences University School of Public Health. Take it away.
Thank you so much. I'm Laura Geer, and I am Associate Professor and Chair in the Department of Environmental and Occupational Health Sciences at SUNY Downstate. We're one of the teaching hospitals downstate located in Brooklyn, New York. And I'm honored to be here today alongside, a distinguished group of panelists. And I wanted to thank Rockefeller Institute and the Local Government Lab for sponsoring this event today. And I'm pleased to be joined in this presentation by our recent Masters of Public Health graduate, Rachel Radigan. She'll be off to med school in the fall. But I got her to run some analyses on the study data for us today. And I'm really thankful that she joined in looking at the data for this study. So the study came about through a COIL Center partnership that I established with a Brazilian researcher at a medical school in Northeast Brazil. So if you haven't heard of it, SUNY sponsors a collaborative online international learning experience through their center. And they have you meet with your partner and aid in helping you design a curriculum module to insert inside an existing course to foster international and virtual learning. So I established this partnership, as I mentioned, with Professor Rosalie Bellian. She's from Northeastern Brazil, Associate Professor in the Medicine Department. And This is where she's located. And initially she reached out to me because she saw an abstract that I had submitted for a conference relating to Zika virus surveillance. So that became the topic around our first module that we designed, co-developed. So this was around use of mobile devices to face public health crises. And it came out of looking at the local cultural contexts of response to the Zika virus outbreak in 2015 that was mostly affecting births in northeastern Brazil and other regions of the globe with cases of microcephaly, which is underdevelopment of the brain in neonates. And unfortunately, Brazil will be dealing with the legacy of Zika virus exposures for decades to come, with like learning disabilities for these children and other types of disabilities. So that's how we developed the first training module, which we implemented in the spring of 2019. So students on both sides of the partnership felt their perspectives on global health issues were enriched through the cross-cultural activities in COIL. And it was interesting because it was really focused on both of our universities deal with training for healthcare students. So whether it be medicine, nursing, public health, informatics. So this cross-cultural exercise laid the groundwork for future efforts to understand cultural influences on risk messaging in public health and for online cross-cultural curriculum development in the health fields. So this laid the foundations quite nicely for us to consider influences and impacts of the COVID-19 pandemic on the life experiences of healthcare students. So we designed a cross-sectional survey that we implemented in October and November of 2020. And it related to these various themes, demographics, COVID-19 characteristics and response, symptomology and illness experience, social influences such as those of mental health and social world perceptions, and also cultural influences on risk and protective behaviors. So Rachel will step in now and talk about some of our very interesting survey results as we compared the SUNY students to the Brazil students. They were very similar cohorts, and it was really fascinating and interesting to be a part of the study. Do you want to take it away, Rachel?
Sure. Are you able to? Perfect. So we had a total of 53 students from the US and 55 from Brazil. And when we compared the two countries, there was a significant difference in age, with the US sample on average being older, and also with gender, with the US having a higher proportion of females. Race and ethnicity were only recorded for the US students, and the distribution of race can be seen here, with our highest proportion consisting of Black or African American students. The US students were also more likely to be public health students, which makes sense since this was implemented in a public health course. The US students were more likely to be employed before the pandemic as well as currently, and this may be associated with the age difference as well as the degree type that the students were attaining. Continuing looking at the demographics, most US students reported they did not consider themselves to be Hispanic or Latino. And when we looked at birth country of the US students, 36 reported being born outside of the US. And of that 36%, 14 different countries were listed as a birthplace. Looking more in depth at employment, we can see that out of those employed, the US students were more likely to be unsatisfied. And out of those unemployed, majority of the US students were seeking employment. And the opposite trends were seen among the Brazil students. Looking at COVID-19 characteristics and symptomology, there were no significant differences in the number of symptoms nor the symptoms experienced between the two countries, and the highest reported symptoms were fatigue and headache. The US students were more likely to have taken a COVID-19 test, which could be tied into the availability, as it was also commonly reported to have widely available tests free of cost among the US students, as opposed to the Brazil students. US students were also more likely to agree with their city or region's policies around COVID-19. For students that reported taking medication for COVID-19, Tylenol or ibuprofen was commonly reported among the US. And as if for my or ivermectin, which are an antibiotic and an antiparasitic, were most common among the Brazil students. When looking at if they agreed with their city, regions, and policies, some of the students had issues with their policies due to the lack of enforcement in policies in place in both countries. Looking more in detail at the US students, they had issues with policy contradictions and operation. Looking at risk and protective behaviors among the students, we can see that there were significant differences in the number of PPE used, with the US most likely being using more than one type. US students commonly reported using both the washable and disposable mask, which correlates to them using more than just one type of PPE. The difference seen between the two countries could be correlated to access, messaging, and/or possible environmental efforts. Significant differences also existed in behavior during the pandemic. US students were more dispersed over their responses, with about a third of the US students reported frequently leaving their house for work, which also ties into the decent proportion of the US students that were being employed at this time. US students were more likely to feel that the places they were visiting had enough sanitization procedures in place, but no significant differences existed on whether they themselves were performing enough sanitization procedures to feel safe and the number of procedures implemented. For the most part, the procedures implemented were the same, except for the use of Lysol-type sprays, in which the US students were more likely to report using. This could be related to access of these products and/or advertisement of them. Majority of the students reported proper PPE use, but this is also self-reported data. Majority of students also reporting having no known risk factors, and of those that did report having risk factors, asthma was the most common among the US students. When looking at the most important risk factor for contagion of COVID-19, students reported crowded places being the most important, followed by people without masks, and then closed places without ventilation. Contaminated shopped items were not overwhelmingly thought of as an important risk factor for contagion. Looking at the social world and mental health, interestingly, there were no significant differences between the two countries in household types, how students felt about their home environment, their degree of contact with their family and friends, how they felt about the pandemic, and mental health related to counseling. US students, for the most part, did report living with their parents or family, felt well about their home environment, contacted their friends and family regularly, were living one day at a time, and never had mental health counseling. All students had no in-person classes and reported living in a house or an apartment, with majority always having reliable internet. Most students reported having no difficulties in maintaining their social relationships during the pandemic, and of those that did, lack of time was most common among US students. For those that reported seeking mental health treatment during the pandemic, money difficulties, grief from the passing of a loved one, and taking care of children and/or family members were common reasons for that. Lastly, no significant differences existed on whether employment changes influence one's mental health. And with that, I'll hand that back over to Dr. Geer.
So I'll just make a few comments on how interesting the social factors were so similar in the two cohorts, the US and the Brazil. And also, how we were dealing with somewhat of a biased sample in terms of, education around the virus and protective behaviors. So, we saw pretty promising results there. One thing we want to talk about in terms of the implications of this survey are how cultural and social differences, risk messaging, and lifestyle factors may have contributed to disparities in perceptions and behaviors of students around the coronavirus, giving implications for future global infectious disease control. So we can learn from this. We can learn about how we can better prepare our students who might also be dealing with these types of stressors in the workplace. They may also be dealing with some of the social determinants of health, such as food shortages or challenges with access to broadband. So these are things that we need to consider into the future for how well we are supporting our students, and also, providing mental health support and these types of things. So the results can be instructive for universities, local governments, and health departments in strategizing for risk messaging and dissemination for future global health challenges, and that could include preparedness for climate-related events, et cetera. So one of the future objectives is to continue with the COIL partnership with the Brazilian partner. And we hope to repeat the survey with a fresh cohort of students in the summer. And we may try and get repeat surveys from some of the students who have already completed the survey. So I just wanted to acknowledge the Brazilian co-authors once again, Rosalie Belian and Lucas Leite, Jose Luis Lima Filo, and the SUNY COIL program and Academy leaders. The Academy leaders change from time to time, but we did want to acknowledge the Academy leaders when we did our initial training in 2019. The students who participated from our public health course, PUBH 5201, the participants, and one of our other MPH students who assisted with the online survey distribution, Kirkland Escondo. So with that, Rachel and I will be happy to take any questions, or will we wait till the end for questions?
Yeah, we're going to wait till the end for questions. I have a bunch. I thought that was very, very interesting, very thought-provoking. And I want to remind the audience that if you do have questions, please just enter them into the Q&A section, and we will take them up after the last presentation. But thank you both. Very good.
Thank you so much. Thanks.
Thank you.
For our next presentation, I'd like to introduce Rebecca Natow. She is the Assistant Professor of Educational Leadership and Policy at Hofstra University. And we're lucky to have her as our Richard P. Nathan Public Policy Fellow here at the Rockefeller Institute. And Rebecca also was recently awarded Teacher of the Year by the Education Department at Hofstra University. So Rebecca, go ahead.
Thank you so much, Brian. And thank you to everybody for attending today. As Brian mentioned, my name is Rebecca Natow, and I'm an Assistant Professor of Educational Leadership and Policy at Hofstra University. And I'm also a Richard P. Nathan Public Policy Fellow with the Rockefeller Institute of Government. And my presentation today is entitled The Role of Local Government in Federal-State Partnerships for Higher Education. Let's see if I can advance my screen here. There we go. So although the topic of federal-state partnerships has been discussed a lot recently in higher education policy circles, there's not much academic literature focusing on these partnerships, and there's not even one widely agreed upon definition of what they mean. So for purposes of my analysis and presentation, federal-state partnerships for higher education are defined as collaborations between states and the federal government to create or implement policy regarding higher education. This is a broad definition encompassing any times that states and the federal government are involved together in higher education policy matters, even if indirectly. And it's also important to note that federal-state partnerships are not necessarily collegial collaborations. And in fact, many times they're viewed as coercive on states, prompting states to take certain actions that they otherwise might not. Federal-state partnerships are increasingly discussed by policymakers and advocates as important tools to increase college affordability, to prompt states to invest more of their own dollars in higher education and thereby reduce the cost burden for students. The federal government can provide funding for states to increase their financial investments in higher education. Policymakers who are in favor of establishing federal-state partnerships to promote college affordability include the chair of the Senate Health, Education, Labor, and Pensions Committee, Senator Patty Murray, the chair of the House Education and Labor Committee, Representative Bobby Scott, and the Undersecretary of Education, James Cabal, among many others. So this slide shows a flow chart of what many state-federal partnerships in higher education have looked like. These are direct, intentional partnerships between states and the federal government. And when you hear people in the higher education policy community talking about federal-state partnerships, these are typically the kind of partnerships they're talking about. Under this model, the federal government provides money to states, and in turn, the states have to agree to provide a certain level of funding or other resources for institutions or higher education students within the state. An example of this type of federal-state partnership is the maintenance of effort requirements of the American Reinvestment and Recovery Act of 2009, and much more recently, the American Rescue Plan. So in these maintenance of effort requirements, states agree in exchange for receiving federal funding that they will maintain a certain level of state financial support for higher education. Analyses of maintenance of effort policies such as this have shown that they have been effective at influencing state legislatures' higher education expenditures and not using the federal dollars to replace state funding for higher education, but to supplement it. This is a pretty straightforward example of a policy instrument called conditional spending, where the federal government attaches requirements to the receipt of federal funding. These state-federal partnerships are pretty direct and straightforward. States need the federal resources. The federal government provides those resources, and in return for that, the states must agree to provide a certain level of resources for higher education within the state. This slide shows another type of federal-state partnership that is less straightforward. This is a situation where the federal government provides funding not to the states, but to the institutions. And in return for that funding, institutions have to abide by certain rules and regulations. So we again see the use of conditional spending here. The federal government provides funding to colleges and universities who must abide by certain rules and regulations as a condition of receiving that funding. However, how the states get involved in this is because some of the standards that institutions must meet can involve state policy in some way. An example of such a partnership arose from federal regulations on state authorization for higher education. The Higher Education Act requires that for institutions to receive Title IV student financial aid funding, they must be authorized to operate in the state in which they are located. That is known as state authorization. Over the past 11 years, the US Department of Education has issued a series of regulations regarding state authorization due to the fact that institutions are increasingly enrolling students located in a number of different states through their distance learning programs. So the federal government wanted to issue regulations to help ensure the quality of such programs. One of the requirements is that institutions must be authorized in all states where they enroll students. If the institution does not receive authorization from every state in which their students are located, then the institution would risk being ineligible to receive federal student financial aid funds for those students. So as you can imagine, for institutions that provide a lot of online courses and degrees, it can be a pretty substantial burden to have to obtain authorization from every single state in which students in those programs are located. So not long after these regulations came out, a number of nonprofit organizations, including regional higher education compacts, collaborated to create a reciprocity agreement known as the State Authorization Reciprocity Agreement, abbreviated as SARA, to enable institutions in a state that is a party to this contract to have that authorization recognized in other states that are also parties to the contract, without the institutions having to go through individualized authorization procedures in all of those states. But there is a caveat. It is the states that have to be parties to the reciprocity contract, not the institutions. Institutions must be approved by their state to have their authorizations recognized elsewhere, but only the state governments can actually join the SARA contract. So research I recently conducted with a grant from the State Higher Education Executive Officers Association and Arnold Ventures found that institutions put pressure on their states to join the SARA contract so that they could avoid having to go and get authorization from a large number of different states. And that pressure has been very effective. Currently, every state other than California has signed on to the SARA contract. Our research found that even some states that were reluctant to join SARA due to concerns that they would lose the power to enforce state-level consumer protection laws against out-of-state higher education institutions, did end up joining the contract eventually due to pressure from the institutions within their state. So as you can see on the flow chart here, the state authorization rule is a federal regulation of institutions, but it involves policies and procedures that occur at the state level. What happens is that states take action to help their institutions meet federal standards due to pressure from those institutions within the state that are relying on the federal funding. This is an indirect federal-state partnership because the partnership emerges from the federal government's regulation of institutions, which then put pressure on the state to take certain actions, such as joining the state authorization reciprocity agreement. Yet another kind of federal-state partnership appears on this slide. This depicts when states act as stakeholders of federal policy. In other words, federal higher education policy often affects states in some way, as I've just explained with regard to other types of federal-state partnerships. And sometimes states, as federal policy stakeholders, work with and advocate before the federal government in favor of policies that benefit their state's interests. In these scenarios, states are one of many stakeholders who work with and advocate before the federal government. Other stakeholders participating in these processes include interest groups, intermediaries, and experts who provide information and work with federal policymakers on policy development and implementation. An example of this type of partnership is the negotiated rulemaking process through which the U.S. Department of Education creates regulations governing student financial aid and other federal higher education programs. Stakeholders, including representatives of state government, participate in various stages of this process, the most prominent of which is negotiated rulemaking, in which the stakeholder representatives meet directly with Department of Education personnel. Another example of state as stakeholder partnership is when state-level actors and other stakeholders serve on a White House commission or testify before congressional committees to provide federal policymakers with information and reasoning on which to base policy decisions. So for the remainder of this presentation, I'll focus on how local governments have been involved in federal-state partnerships in the higher education policy arena. There are various ways and various local policy actors that have been involved in all three types of those partnerships. These include, for example, city officials, county officials, and sometimes local school districts. Community colleges have played a fairly prominent role in federal-state partnerships for higher education, and community colleges are themselves a state-local partnership. These institutions are funded in part by local governments, and local officials often have a role in appointing members of the Board of Trustees. But state-level officials do as well. So for example, in New York State, community colleges are part of the City University of New York system or the State University of New York system, SUNY. And in the SUNY system, each community college has a local municipal sponsor, such as the county government. And community colleges in the SUNY system receive both state and local funding. And some members of the Board of Trustees are appointed by the local municipal sponsor, while others are appointed by the governor. Through community colleges, local governments have had a fair amount of involvement in federal-state partnerships for higher education. This slide shows some examples of how local governments have been involved in direct higher education policy partnerships. The model on the left depicts partnerships under the Workforce Innovation and Opportunity Act, or WIOA, which was enacted in 2014. The WIOA created federal, state, local partnerships in an effort to improve workforce development in the United States. Under this policy, federal funding goes to state and local workforce boards, and community college workforce development programs often receive support through WIOA. The diagram in the upper right corner shows the federal government providing support to states and partnerships, and this depicts a program such as Geer Up, which stands for Gaining Early Awareness and Readiness for Undergraduate Programs. This is a federally funded program that provides educational interventions and scholarships for middle and high school students in high poverty schools with the goal of increasing college access for underserved students. The U.S. Department of Education provides two types of competitive grants through Geer Up, one to state governments and one to partnerships. And the partnerships are between higher education institutions and local government agencies, which are basically local government entities such as a school district or a county level Department of Education. Finally, on the lower right side of this slide, you'll see the example of cooperative extension services. These are federal, state, local partnerships that operate through land-grant colleges and universities to provide agricultural and related education within communities. Extension programs are funded by federal, state, and local governments, as well as some private sources. So these are just a few examples of direct partnerships between the federal, state, and local governments in the higher education policy arena. But what they all have in common is an intention by federal policymakers to involve states and local governments in a particular federal program. The collaboration between the federal and subnational governments is evident from the federal policy itself. It is a direct partnership. On this slide, we see examples of indirect partnerships. On the left, there's the indirect partnership I discussed a few moments ago with regard to states being prompted to act by a federal mandate or a financial, not by a federal mandate or financial incentive, but through pressure from institutions such as community colleges. And our research indicated that community colleges were among the institutions that were pressuring their states to join the SARA contract. On the right is a partnership that is also indirect and not often discussed as a partnership, and that is the funding of colleges. The economist Sandy Baum, writing for the Urban Institute, has identified the funding of public higher education institutions as a partnership between the state and local governments. And in the case of community colleges, local governments too, and one that was, quote, developed without a clear blueprint. That's a quote from Sandy Baum. As the model on the right side of this slide shows, community colleges are funded through many sources, including federal, state, and local governments, students and their families, and other sources. So this is another form of indirect partnership because these are all relatively independent funding sources, and they're all contributing essential revenues to higher education institutions, much needed revenues. In this case, community colleges, because the local funding is involved with them as well. Finally, local government entities participate in subnational government as shareholder partnerships. As explained on an earlier slide, these partnerships include the U.S. Department of Education's negotiated rulemaking process, in which stakeholders meet with agency representatives in an attempt to draft proposed language for forthcoming regulations. Community colleges, along with other types of higher education institutions, are typically represented in these sessions. Representatives of community colleges may also join with other stakeholders to provide information to the federal government during congressional hearings or special commissions or councils convened by the White House. For example, President Obama's White House Rural Council met with and obtained information from a variety of stakeholders, including representatives of rural community colleges. The White House Rural Council launched initiatives to increase rural community colleges' access to resources that can enhance and expand their workforce development programs. And the community college representatives' feedback to the council helped to inform those policies. So to summarize, local governments have been involved in a number of ways in partnerships between the states and the federal government in higher education. Examples include local workforce and investment boards receiving funding and implementing programming under WIOA, cooperative extension services that use federal, state, and local resources to provide evidence-based agricultural training in local communities, and community college representatives participating as stakeholders in federal policymaking processes. Indeed, it is the community colleges, which are themselves a form of state-local partnership, that are heavily involved in federal-state partnerships for higher education, whether acting as interest groups in policy processes, by pressuring states to change their policies so that colleges can have an easier time complying with federal law, by receiving funding from federal, state, and local governments, and by implementing federal workforce development programming. Other local government entities that have been involved in federal-state partnerships for higher education include school districts and city or county governments. So thank you so much for your attention, and I'll look forward to your questions at the end of all the presentations.
Thank you very much, Rebecca. And I do want to remind attendees, please, if you have questions for any of the panelists, enter them in the Q&A box, and we'll get to them after the presentations. Our next panelist is Renee Parmar, professor of measurement and evaluation at St. John's University in New York. And she's also a Nathan Public Policy Fellow here at the Rockefeller Institute with us. Renee?
Thank you, Brian, and good afternoon. You'd think we'd have this mute-unmute thing worked out by now. And thank you to the Rockefeller Institute for hosting this conference and for inviting me as well. Today, I'm going to share a little bit about some research that I've been engaged in related to analyzing some data from the New York City Teacher Survey. This is a large survey that is sent out to teachers, parents, and students across New York City. And in the case of Teacher Survey, it consists of a large number of items, but teachers are allowed time to respond to it. So it has a fairly high response rate. The interest that I have in this particular line of research stems from the fact that many school leaders are not very well or extensively prepared in how to lead special education programs within their schools. And this has been based on research from several decades, but the research does note that many school leaders don't have special ed leadership training, although they spend quite a bit of their time, 20 hours per week on average, on special education related issues in their school. So it is quite a large part of their responsibility. And in fact, recent meta-analyses have indicated that professional development for leaders in special education has declined in the past 3 decades. And instead, it seems to have been replaced by an increase in professional development on accountability. So there's been kind of a shift in emphasis, which has led to some changes in how school climate is viewed. And further, there have been studies that indicate that teacher attrition in special education is quite high, and some of it is related to the leadership and frustrations with that. So that leads me to the purpose of this study, which is to look at teacher perceptions of the relationship between special ed representation in schools and school leadership from the New York School Survey. And I'm going to focus on 2 dimensions of the survey, which are effective school leadership and supportive environment. I obtained the data from the New York City website, the Info Hub. I compiled data from demographic data, school quality reports, and the school survey, and these are all publicly available data. What I'm going to report on today are the data from 1,293 elementary, combined K-8, and middle schools, which represent over 14,000 teachers. The average response rate per school is about 83%, quite high, and the data are aggregated by school. Just to give you a little bit of background on the schools themselves, I kind of broke them down into elementary, K-8, and middle schools to show you the percentage of students who are in special education in these various schools. And if you note that these percentages are quite high, they are quite a bit higher than the national average of about 13 to 14%. And the percent of students in special education self-contained classes is also quite high compared to the national average. The New York School Survey is based on the framework for grade schools developed by Brick et al. Based on their research in Chicago. There are 26 items with some sub-items for a total of 150 questions. Teachers are provided with some professional development time to respond to the survey because otherwise it's extremely long and probably no one would respond to anything with 150 questions if it were just to randomly arrive in their email. Most of the questions are on a 6-point Likert scale and some are on a 4-point rating scale. Information on reliability and validity of the survey are found in the documentation from the Research Alliance for New York City Schools at NYU. And the most recent report is by Merrill and Lafayette in 2018 that establishes information indicating that the scale is quite good in terms of internal consistency and also its content validity with the BRIC framework as well as the Danielson framework. So I looked at, first of all, the dimension of effective leadership within the New York City survey. And this, in terms of teacher responses, consists of approximately 17 items, and they are divided up into 3 different categories. I conducted a regression analysis to first of all see whether the percent of students who are in self-contained placements and the percent of students with disabilities had any impact on leadership ratings of principals by the teachers. And I found that both of these variables in a regression analysis were significant negative predictors. That is to say, the higher the percentage of students in these groups in a school, the lower the effective leadership rating tended to be. Now, this was not a very large effect. The overall R square explains about 13% of the variance, so not huge, but also not small. I also found that years that a principal spent at a school had a positive effect on their leadership ratings, and student attendance had a positive effect on leadership ratings. To break this down a little bit into the specific items, I just want to highlight the darker bar, which was the lower score in terms of program coherence, one of the subscales of effective leadership. And here the lower score was obtained on the question of, once we start a new program, we follow up to make sure it's working. So this indicates that in teachers' views, there were instances in their schools where programs were initiated, but there wasn't enough follow-up. And that seemed to be more the case in schools that had higher special education populations, as indicated by these significant negative correlations. It also was not as clear as to how the programs were connected to the school vision, and also how curriculum instruction and learning materials were coordinated across different grade levels. And so when we think about these factors, I just related this to some of the prior research, which also has noted that there's often an inverse correlation between high scores on management, that based on a survey by Salisbury, and inclusion in the schools of special education students into the general ed program. And then Templeton has indicated that principals need to go beyond legal and procedural concerns of special ed programs to really focus on curriculum and instruction. And they need to really manage and acquire special ed personnel in a way that really promotes their staying at the school rather than leaving the school quickly. Another component of effective leadership was instructional leadership. And in this, I've just highlighted again the lowest bar, which is that the school leader engages in instructional planning with teams of teachers. And so this is a critical component of integrating special education into the whole school program and the school functioning, is to really work with teams of teachers, because every teacher is involved in special ed service delivery. They're included, so the general ed teachers are involved. Of course, the special ed teachers are involved, related service personnel involved, and it's very important for a school leader to be able to work with these teams. Again, significant negative correlations were observed based on scores on instructional leadership and percent of students with disabilities and percent of students in self-contained settings, with the item of school leader sets high standards for student learning being the most notable in terms of its negative correlation. To relate this to some of the prior research, Sindelar conducted a case study where they observed that principals sometimes redirected resources from special education into direct instruction and test preparation. And this relates back to the accountability piece, which has become an overwhelming focus of school leaders as compared to their focus on providing programs that serve the students' needs. There was also some research that indicated that school leaders are not often knowledgeable about what are evidence-based practices for differentiation, and they have many different interpretations of what consists of evidence-based practice. The third area was teacher influence, and here we see that school leaders were rated low in engaging teachers in hiring new personnel and in planning how the school will be organized. Not very surprising, again, negative correlations observed. And here we see prior research indicating that the longer the principal is at a school and has more experience, the more comfortable they are seeking teacher input. So very important for school leaders to remain at a school in addition to teachers. In the dimension of supportive environment, again, the percent of students self-contained had a negative relationship with ratings on supportive environment, whereas some of the other factors had positive ratings. There are two dimensions of supportive environment. One is classroom behavior. Here, the lowest scores were in students in classes listening carefully when the teacher gave directions, paying attention, and behaving well. Significant negative correlations depending on the percent of special education students in the school. And we know that behavior is a major concern when teachers make referrals for special education services and when they talk about inclusion in their classes. And so there are a number of different research studies that have indicated that elementary school principals or principals throughout should play a really key role in inclusion and the success of inclusion programs and how they define least restrictive environment, how they communicate with the teachers, and how they set up the school climate for inclusion has a huge impact on how teachers perceive their ability and their supports in managing behavior. And finally, supportive environment includes social emotional components. And there were low scores in several areas about adults in the school recognizing disruptive behavior as a social emotional learning opportunity. Also lower scores in teaching students the skills they need to regulate their behavior and how to advocate for themselves. Significant negative correlations with the percent of students in special education at these schools and the various indicators of social emotional support. And here, prior research points out to the fact that school leaders really need to employ very assertive strategies for inclusion and create a culture of reform with social justice values and model that behavior, not just focusing again on legalities, but really on how the school is going to support all students. So there are, of course, limitations to this particular piece of research. It's a bit of an introductory study on this from the 2019 data, but I do hope to continue this in the future. And I welcome your questions as we reach that questioning stage. Thank you very much.
Thank you so much, Renee. Very interesting. And let's go on to our next panel. And for this fourth presentation, we'll have Deborah Napolitano, who is Assistant Professor in Applied Behavior Analysis at Damon College, as well as a consultant to the Golisano Institute for Developmental Disability Nursing at St. John Fisher College. And also we have Julia Donnaruma, a Senior Advisor in the Government and Regulatory Practice at Manat, Phelps and Phillips's Albany office. I hear that you are actively lobbying today as the New York State session comes to an end. So this is going to be quite interesting and timely presentation. Go ahead and take it away.
Yes. Is my screen being shared?
Yes, Debbie.
Okay, I couldn't tell. I'm sorry. All right. Hello, everybody. Timely doesn't even cover it. We heard about half an hour ago that that one of the bill that we're speaking about today passed on the Senate floor. So cut to the chase. We're pretty excited. So I'm going to do my best here. So today we're going to talk about statewide advocacy for legislative change for a profession. And it really is interesting how these talks really do go together. We're talking about some of the needs of children in some special education settings, and the behavioral needs are one of the reasons why this legislation was so important, because we have such a dearth of behavior analysts in New York because of what we'll talk about today. So just New York is well known for its robust service delivery and supports for individuals with intellectual and developmental disabilities. Certainly less so for those who have who may not have the same access to the same services in certain communities, but generally New York is well known for the robust service delivery. But there's been challenges with adequate licensure and practice opportunities that have really impacted the way that behavior analysts are able to support patients and have flexibility. So today we're going to talk through the history of our legislative efforts in New York State for this profession, discuss the ways that the scope restriction that we'll talk about has impacted the service provision, highlight the strategies that we've used to elevate the issues and grow community support. I am so sorry. And describe and define our next steps. So, okay, sorry. Of course. So we're going to talk a little bit about our legislative history. Back in 2011, so the insurance mandate for autism was approved in New York, and what that did was it allowed behavior analysts to be able to provide services, board certified behavior analysts to provide services to individuals with autism. And that's because behavior analysis is one of the primary services that are effective for individuals with autism. So what happened though is that the bill called for board certified behavior analysts, and the Department of Financial Services and State Education Department said that that behavior analysts, because they didn't have a license, couldn't provide the services. So that left very few people who were duly licensed in psychology and behavior analysis available to provide the services. So a licensure bill was introduced into the Senate and the Assembly, and behavior analysts, board certified behavior analysts, were temporarily able to provide the services, but the licensure bill was only able to be enacted after much negotiation in a very restrictive way. So behavior analysts in any place in the country provide services based on their scope of competence and training. But in New York, it was essentially enacted, the license was enacted in order to fix the insurance law, so essentially. And so the scope of practice of behavior analysts were limited. And then not only were they limited by autism and the description of autism and related disorders, as many people will know, related disorders could cover a whole host of things. State Education Department essentially said that related disorders only meant the fact that the new diagnostic manual was changed, or was changing, and so really restricted it to just autism. So we started to see problems that were related, and we'll talk about those, to this restriction. So in 2017, we began the process of trying to change the scope. And we've been working on that for 5 years, since 2017. And we didn't have to be able to put on this until now, that it actually just passed the Senate about a half an hour ago. So it's now passed the Assembly and the Senate, and it will be on to the governor. And I'm having a hard time speaking because the speeches by Senator Mannion and Senator Skoufis, Senator Skoufis was our sponsor, were very emotional. So, the strategies that we really focused on as behavior analysts were using the data. So, we often say as behavior analysts, show me the data. And there was a study in 2019 that showed that we had the least number of behavior analysts in New York, in the whole Northeast. And you can see that's this small dark bar. And then the percent of growth of the profession also declined significantly after the enactment of the new and restricted license. And also what you can see is that the percent of growth in new behavior analysts, despite a significant growth in other places in the country, we began to diverge from the rest of the country in growth. That's this last graph on the bottom right that demonstrated that it was essentially when the license was enacted that behavior analysis, the profession, and new growth in our profession was decreasing. And this while the new diagnosis of autism was increasing. So you can imagine what that does to supply of the professionals. We also collected other data to try and demonstrate some of the problems. We showed that many folks trying to come to New York were denied licenses, 55% of this survey that we conducted, and that 70%, these are small numbers, but 70% of folks said that that they were of people surveyed that they would be considering or are thinking about or will be moving out of state because of this. We also were able to show that with some larger numbers of survey respondents that that there's many people who said they would like to work in New York, but who live in neighboring states, but they can't, but they would if the scope was changed. And that's because when you restrict the scope to a particular diagnosis, and in this case, autism, for a profession, it would be like saying to a teacher, you can only teach the person in your class who has autism. And so, so it became really problematic for folks who were trained in other ways to get licensed in New York. And so that also became pretty well known. So also what we did was we tried to use some visuals to demonstrate the problem. So there are now 32 other states besides New York that have licenses in the profession, and most of the states that don't have licenses allow people to practice with just the national certification. And so in all those other states, including there's actually no other state, and including the ones that have licensure, that restrict the scope of practice of behavior analysts to any diagnosis, because it's generally not seen only as a medical, within the medical model. But in New York, because it was enacted specifically for autism, it really is seen through the lens of provision of medical or medically necessary services. But again, New York was the only state that had this restriction, so we were showing this visual. And who's affected by the restriction? Families, people without a diagnosis of autism, students, universities, and the professionals themselves. I've already talked about some of these, some of the data, but there was a 19% increase in job postings for board certified behavior analysts in New York just in the last year. And you can imagine how hard that made it to find a behavior analyst with a very limited supply. But we also had the flat growth as I mentioned. And there are so many folks who could benefit from the services. And we heard about some of the children in schools who struggle with behavioral challenges or behavioral needs. And that is one area that behavior analysts will partner often with teachers and school psychologists and administrators to provide services and supports that are so necessary for individuals in school settings. So that was one place where there was significant lack of support. So I think I'm turning it over to my amazing colleague, Julia here,
who is muting her other devices. So for an issue that has been met with quite a bit of controversy and a lot of differing opinions, it was really helpful for us to identify our allies. We believe that one thing that helped us get this far was having multiple organizations embrace our objective. And so coalition building in this instance was immensely helpful. To be honest, it was important, and it was also helpful for me. And I think all of us to remember that, everyone has different reasons for caring about a particular issue. So for example, in our case, someone might ask the question, why would parents care about a piece of legislation that changes the scope of practice for this profession? And, we could certainly make assumptions about how licensing restriction is affecting or even hurting families. So, for example, a parent can't find a behavior analyst for their child because the child hasn't been diagnosed with autism. But I had difficulty with that, and it seemed disingenuous for the profession itself to be making that case. So we went out and we found parents, we found families who could talk about this from, firsthand. And really, Debbie's networking efforts and the association's networking efforts really brought this group of organizations together. And you'll see the hospitals, the Hospital Association, the Healthcare Association on there as well. Why would hospitals be interested in this issue? When a patient with challenging behavior presents in the emergency department, the behavior analyst on staff cannot get involved unless the patient has autism. So even, so different organizations from across the state and country really had a vested interest in this happening. And, in terms of coalition building, we weren't just relying on our own networks, but every time you add someone new to the coalition, you get another network as well. You can move forward, Debbie, please. And so I put this slide together just to say that, of course, building a coalition was just part of our strategy. Definitely for the bill that we were trying to advance, the actual text, that actually represents a negotiation that took several years and which we concluded with the state education department, I think just a couple of months ago, maybe in April or May. And that was very, very important to the chairs of the higher education committees in both houses of the legislature. It was also very important to our sponsors. And so it was at the request of the chairs about a year ago that in addition to working with the state education department, they wanted us to engage with some of the opposition. And at the time, there was one known association that had already come out in opposition to the bill. So we met with them. And to be perfectly honest, the one benefit, I'm looking at the list of things I have here, the one benefit to remote meetings and Zoom right now as a way of doing business was really volume. We conducted dozens upon dozens of meetings, which really helped us drive the support we needed for the bill. So you can move, and those are, we've also listed other organizations and individuals we had to meet with over the last year, just in the time since I've started working with Debbie, which was in the fall of 2019. But this really is the culmination of the 7-year effort, I should say. So, next steps, as Debbie already mentioned, our bill just passed a little while ago. Unfortunately, I missed the whole thing, so I'm really grateful for digital recordings, and I'll try to get a chance to watch it later this evening. So, of course, we're very hopeful that the bill will be signed by the governor. And, I mentioned our opposition earlier. 48 hours ago, Debbie and I were planning a very different presentation because we were already planning what we were going to do all summer, assuming that this didn't get out of the Senate, because it really has been touch and go for the last 12 days or so. But, looking beyond, we have a lot more to do. Once everyone has had a chance to celebrate and just sort of stare in wonder and awe, we have a lot more to do moving forward. And that will involve, engaging the state education department on regulations and rules and implementation. And the profession has a lot of other areas of interest that they want to look at as well. There's legislation pending right now on, which I think I've put there in the bullets, that actually would expand ABA coverage to Medicaid recipients. Right now, even though there was an insurance mandate passed, as Debbie mentioned, back in 2011, that insurance mandate did not cover the Medicaid program. And so the advocates, especially those in the autism community, have been fighting ever since to ensure Medicaid coverage of ABA services. And the legislature is using that bill to help push the state along in their very slow implementation of that piece of this puzzle. But our efforts will continue. We've got a lot more to do.
Yeah, so really just to wrap up, the key to moving this forward is legislative advocacy, the relationship building, and helping to identify the people who are going to really care about your issue. And I am going to say finding the right lobbyist who cares about your issue, cares so much about your issue that she does whatever she can to move it forward. And finding the right legislators who care so much that they will stand up and try and do everything they can to move it forward. The repeated message, the consistent and repeated message is critical. Every opportunity is that you meet somebody new is an opportunity to spread the message, to find, you never know who that right person is, who's going to be the key to making this move forward, to making your and who will be interested in joining your coalition. And a lot of that has to do with finding shared interests and values and shared and shared advocacy. And so being available to advocate on their behalf as well. So I've joined a variety of groups that I really care about. And we just did federal advocacy at the federal level with some of them last week. And it's really important when you find people with shared interests and values that you support each other. That's really what this grassroots advocacy is about. And if anybody has an interest in the field, we clearly need many more in New York.
Well, thank you guys so much. I think it was a great example of the advocacy effort that's necessary to take data analysis and policy analysis and actually turn it into applied data analysis and applied policy analysis. There's an actual real step that's necessary to put that in action. And congratulations on your success just today. That's very good. Can't wait till we get to questions and answers. One last reminder for the audience for questions for any of our panelists today. Please just enter them into the Q&A section and we'll get to them after this next panel. And here for our final presentation of the day, please welcome Casey Jakubowski. And he's the founder of CTJ Solutions, LLC, and a 20-year veteran of education and improvement specialist. Casey, go ahead.
Thank you so much. Can everybody see this or no? Maybe not. I will try one more time. Let's see if I can do it. There we go. It's only been a year, right? All right. So I'm going to talk a little bit about a big issue facing our rural communities throughout New York State, and that is the ongoing demand by folks for school districts and local communities, including villages and special districts, to rethink their operating procedures by dissolving. And in my research, which came out of my dissertation for my doctorate on this area, I found a really interesting pattern that has emerged. For New York State especially, centralization and consolidation of school districts, as well as local municipalities, has been ongoing. For schools specifically, it's over 100 years old. And the idea emerged out of reformer movements to try to increase efficiency as well as effectiveness in those local school district areas. Because there is a perception throughout reform efforts that bigger is better, and that by increasing the size of school districts, you can therefore allow teachers to specialize, you can decrease the tax rate, you can essentially get an economy of scale and some cost savings on it. And what we as researchers in the history of education and rural education have noticed is there is a consistent call by politicians to do something to change education at the local rural level throughout many states in the United States. This is extremely timely in that not only are there ongoing consolidation attempts in New York, but most other states in the Northeast, as well as the central parts of the state, have this level of consolidation, centralization going on. You tend not to see this out in the West and in the South as much because they're already largely county-based systems, and many of them have gone through consolidations. What you're noticing in the other states is school closures. This is a very different approach than what I'm taking, because in my research, none of the districts up in front of the studies said they were going to close schools in the consolidation. What they wanted to do was to increase the organizational efficiency, decrease the tax rates, and create a more effective program or offer more for students. And the question is why? Why is New York, which isn't really in many people's opinion, a rural state so concerned about this? Well, there's two basic reasons. First of all, New York transfers almost 50% of its state level budget to local schools and local governments. And the second reason is that, believe it or not, almost 40% of New York schools are actually classified as rural by the National Center for Education Statistics. So we have a large rural population for our own communities and our own citizens in the state. I wanted to observe why, when the state was offering all of this additional consolidation aid, and in many places offering local government officials aid to centralize or to dissolve, almost all of them failed. And not only was there operating aid, which, as we've all realized in the last 10 years between the Great Recession, as well as what's been happening with the COVID-19 pandemic, many of our local schools and our local communities are underfunded and hanging on by a thread. And as we're also seeing right now at the national level, for a lot of districts, the aid that was promised by Consolidation to redo the school building is something that now they're hoping just to get in the general budget. And for those of you who are surviving the really humid days that we've been having recently, think of our poor teachers who are in the schools and our even poorer students who have to take the Regents exams in the cafeterias. It's not fun. We've also seen quite a large vocal support from politicians and state educational leaders emphasizing these consolidation movements. So what happens in the research? Well, Parshall in 2019, who is a Rockefeller member, and I must express my thanks to her and the institution for this opportunity, really identified some identity issues as part of the reasons why school districts and communities tend not to dissolve their villages or consolidate their schools. And what you see happening is identity issues do come to the front, but also there is a fear of taxes going up. Because even though one of the stated goals of many of these consolidation and dissolution studies are to decrease taxes, when you read the fine print, you realize that, well, for the immediacy, the tax rate may be held, or it may actually increase for a few years until the aid kicks in long enough. There's also another area which I think Parshall really emphasized, which was the idea that once you dissolve and once you give up the building, then there is no hope. And this is especially true in many rural schools where the building represents the community and it represents the struggle that the community has undertaken. It's also a matter of point of pride for many of community members, as they thoroughly believe and thoroughly are trying very hard to provide their students with a good education. And so when the studies are done, they often identify the gaps. They identify the areas where the community has not been able to provide the most state-of-the-art education. Also, rural consumers and rural residents are not unattached to information sharing. And for many in the area, it's frustrating to hear that a district that is suburban and well-funded had to cut a modified sports team when the district itself in the rural area had to eliminate sports, or that a community couldn't offer elementary school children the opportunity to study a foreign language, yet their own children are limited to one based upon state mandates. It's coming out of this paper comes out of my study, which for my dissertation, I looked at 4 consolidation attempts across New York State, 2 small rural districts and 2 remote town districts. And I looked at 3 sources of information: official documents, local newspaper reports, and I also examined online anonymous discourse posts. I used a number of different case study techniques, including Stake Exemplars case study, and I also used Yin's case study. There was a little bit of ethnography engaged, and there was also quite a bit of content analysis by Krippendorfer. As a Master's of History student from Binghamton, go Bearcats, I very emphatically wanted to believe that while not having lived through these consolidations as a community member, I wanted to give authentic voice to folks who were not part of the mainstream and also who are not part of the elite discussion, which is often covered in the official documents as well as through media coverage. And what I found was that across the board, there's some cognitive dissonance going on. So officials believed very emphatically in their roles as superintendents, boards of education members, that a consolidation of districts or a dissolution of community in the form of a village would actually improve efficiency and effectiveness. And they also identified and adopted a narrative of greater opportunity for students, as well as greater collaboration if they were discussing a village dissolving into a town. The newspapers had a similar message to the state officials, but they also began to put up a counter narrative discussing resistance. And what they would do is they would re-echo tropes or schemas that have identified rural opposition as something related to uneducated or boosterism or centrally focused on they themselves. When I found that there were quite a few people in the online discussions who divided between pro and con, but they used a much more sophisticated route than just, we don't want to lose our mascot, or we don't want to go with this other community. They really looked at and identified places where school consolidation or village dissolution didn't work elsewhere. They also asked about how they could trust the state when the governor's narrative to school districts has been something of the effect of, we don't have any extra money, please don't ask us for extra money, we can't give you extra money. And then usually in election season, there's a lot of extra money. They also talked about the fact that there is, and this is where alignment with Kathy Kramer's research has come really close. And Dr. Patty Strach worked very closely with Dr. Kramer on this, that rural community identity establishes not an us versus them, but they don't get us and we don't necessarily get them. But what's happened though, is this almost detente has dissolved, where rural communities are now really skeptical about why Albany, and that's almost a code in a way for saying New York City or urban areas, don't care about the rest of upstate. And so I think that what's really clear is that what we have is a series of rural schemas. And this shortcut to thinking allows us to begin to identify where a narrative needs to change and how we're going to need refutational texts and epistemological education of how to change this narrative. First and foremost, it's very clear that on a national scape for a long time now, almost 40 years, the discussion has been that government is inefficient. And yet I myself, having been part of the government, as well as seeing friends of mine they're inefficient because they're understaffed. The other area that's happening is that the state, in the opinion or the schemas, is that it values downstate more. Yet in reality, we see massive transfers of funds to upstate in the forms of aid to schools, aid to community colleges, aid to SUNY schools, local government aid, the unemployment resources. There's also this schema that indicates that officials at multiple levels align with special interests. And yet New York has some pretty good established ethics laws. And there's also accountability for some of those behaviors. So I think that sometimes these schemas get in the way of reality. And this is going to take the use of refutational texts that provide concrete examples that indicate to people that their schema does not identify and utilize the reality, but instead a perception. However, refutational texts based upon research throughout education, throughout communications and political science and sociology indicate that this is a massive amount of time and effort to make this change. In fact, on one recent study that was published in one of the leading education journals, the study found it took 15 exposures to refutational texts in order to begin to make a slight movement. So in conclusion, what we see is that, whoops, sorry, too fast. Reformer who mixed money and values creates a message that confuses the people. Also, because local government, including schools, are extraordinarily complex, we need experts who can operate these multi-million-dollar machines on a regular basis. But we also need to do a better job of trying to help local residents who view proposals based upon their pre-developed schemas see beyond those. And so we need refutational texts. We need consistent, steady exposure to not only about the what, but the how and the why behind the thinking. And this is going to be a long, time-consuming and resource-intensive process. And I do think that one of the areas that needs to happen is statewide is that we as leaders and we as community members, we really need to challenge the us versus them mentality of upstate, downstate, and rural versus urban. I think what we need to do is we need to begin to have dialogue about how much we have in common. Because at the end of the day, if a community is starved of resources or cannot educate its children, no matter where it is, we've lost what the state education department calls its mission and vision to raise the knowledge, skills, and ability of all citizens in the state of New York. And I thought it was very prescient that I go last today when some of my previous colleagues have indicated that the reform efforts that we've seen haven't quite done what the reformers wanted them to do. And I think this is another area where we as scientists, we as researchers need to engage a lot more with the public so that they can understand what's happening. Thank you very much, and I appreciate your time.
Thank you so much, Casey. That concludes our panelist presentations, and I'd like to open it up for questions. Remind the audience that any questions you have, please submit to the Q&A box. And I think I'm going to take moderator's privilege and ask one of the first ones, if I can. And this will be to Debbie and Julia, if you guys are here and willing. From your timeline and your presentation, it looked like you used a fairly deep dive into data to build and solidify your coalition. And then you used your coalition to influence the legislature. My question is, how important, if at all, was data in influencing the legislature? Or was that really the progression that you saw?
Oh, I think it was very helpful with the legislature. You really need to, I'm not a data person. It's great that Debbie is. And you need facts. You have to be able to build a very compelling case, especially when these issues are controversial, even when they're not controversial. They can't just rely on your word. And so when you have data behind what you're trying to explain and what you're trying to do, it makes it that much more real. And, you know, legislators need facts behind what's happening. They need to be able to understand, you know, the reality of what's happening on the ground. And so Debbie and her colleagues were able to pull that together. And I think it made a tremendous difference when we were meeting with legislators, when we were meeting with the governor's office. We've already had a couple of meetings with the governor's office, but it's been a while. And when we've been trying to bring other advocacy groups in, into the fold, into the mix, a lot of our organizations, I think it helped for them as well to see the data.
And I would just add, one of the things we often heard was in the beginning of this, way back when, was, oh, they don't want to see data. They don't want it. But that ultimately really was an important part. But it was how the data were presented, and so we worked a lot on presentation of the data in a way that was easily consumable, because otherwise we would lose them if the data were too complex.
Well, thanks. Well, let me now then throw it to Renee, which I think the opportunity you have with some of your findings is tremendous for a data-driven policy action in terms of training leaders based on what you found in your special ed survey. What do you see as the next step for taking what your findings are and actually effectuating the change that you see needed with school leaders?
Thank you. Actually, before I respond to that, I just want to say, underscore the point that Deborah raised. It's very important to present the data in a consumable way. And, you know, here I was at a research forum, I could present, you know, regression analysis, but I wouldn't do that if I were going to really impact policy. But one of the things that we are working on, actually, I'm on a task force. We are looking to take some of the America Recovery Act funding that has come to New York State for teacher professional development and turn it towards leadership professional development. We recognize that special education students were inordinately impacted by the pandemic shutdowns, and really the services that were provided were, you know, especially the sort of things that require the one-to-one services, you know, they really were very severely restricted. And so a lot of students need much support, but leaders need support in terms of how to best get the programs in place that serve these students. And rather than viewing the presence of special education students as just kind of a chore where they have to attend more committee meetings and deal with irate parents, we want to really take a positive asset-based approach in terms of leadership preparation to work with diverse students, diverse learning needs, and really look at that whole, looking at it very holistically to support. And, you know, this is related to state policies for multi-tier systems of support. Challenging behaviors on the part of students remains the most frequently cited reason for referral. So we really need leaders to think about that as an issue and to realize that there need to be school-wide efforts to include all students and to support their success. So that's where we're hoping to go next.
Thank you. All right, Rebecca Natow, I have a question for you. I think you showed and gave some examples of sort of the feds giving direct influence policy or aid to the local aspects of higher education. I think you can see this in things like grant programs to HBCUs and other programs like that. I guess my question for you is how much do we see local influencing bypassing states and going to the feds, if at all? In particular, since a lot of the local higher ed connections are community college, which are part of state systems.
Yeah.
One of the things that is interesting to me is we're seeing some movements, and then this gets to some of what Casey's talking about too, is consolidations of community colleges.
Yep.
Which seem to be driven by, state systems looking to impose their will on these community colleges. But do we have any community colleges running to the feds to try to stop that?
Yeah, that's such a great question, and I think your observation that it's mostly sort of going in the direction of states having more control over the community colleges and collaborating with the community colleges is absolutely right. I do see sometimes the community colleges or the local government agencies, they do some direct lobbying, but it's in the higher education space, you don't see that as often as a collaboration with the state. And I think that's largely because of the way the systems are structured and the way the systems are funded. So there is, as I mentioned in my presentation, local governance and local funding, but that's becoming a much smaller share of revenues for community colleges. And localities themselves, they get their authority to govern as a delegation of the power from the state to the local government. So when you see situations like in higher education where states are starting to take back that power, then it becomes more of a state priority and less of a local priority. And then you see the local governments collaborating with the states instead of doing their own direct lobbying. So that, especially in the higher ed space where the federal and state funding is really, really important. That's what you're seeing a lot of.
Thank you. Casey, I know that you're talking mostly about K-12 consolidations, but have you seen any similarities in the community college aspects? It seems to me, and I know that some of Lisa Parshall, who put this whole thing together, by the way, some of her work seems to be consistent, whether it's a village or municipal consolidation, or whether it's local schools, or whether it's community colleges, and it seems to be 95% identity. And just wanted to get your take on that.
Yeah, thank you. And yes, and for my previous panel, my colleagues who've done the previous panelists, I want to echo the amazing work that you've all done explaining your hard data in a emotionally digestible way. And that's what we see is in Pennsylvania right now. The state has proposed to consolidate not community colleges, but actual four-year colleges. And I know that in New York, we had not that long ago in living memory, proposals to have presidents shared between institutions, especially in the North Country and in some of the rural areas. That went over not well. Something about swearing in church, I believe the expression is. But the reality is in New York, education K-12 and higher education is a huge economic driver. And for a number of these local communities, without the school or without the college, the community dies. And Tom Lyson from Cornell, may he rest in peace, he passed away way too early from a horrible disease, really did a phenomenal job of showing how rural communities that had a school in it were so higher on community amenity scales than schools or communities that had lost their schools. The other area we're seeing is, and excuse me for making this rather blunt statement, up until recently, an active de-investment in education compared to our international colleagues, where when I talk to folks who are in Europe and we explain how we have to pay tuition and students need jobs in order to keep body and soul together, they go, excuse me, they don't, what? And they're like, wait, you're a rich country, what are you doing? And I can only do this. And you see other places as well where the creation, especially after communism, and the creation, especially after a lot of other post-colonial movements of universities, and the worldwide investment in the creation of technical universities in sub-Saharan Africa, as well as the MENA region, universities are literally popping up overnight, because as our colleagues in Japan did, they realized that human resources are the #1 most renewable resources. And so when I see the consistent starvation at the K-12 level and the consistent starvation at the higher education level, it frightens me, you know. And there was a great story about University of Buffalo being absorbed into SUNY, and how the newly appointed department chair of the English department was told, you can hire as many people as you need for tenured positions, not even tenure track, but tenured positions. So post-World War II with the GI Bill, really, there was a huge national investment. And I just realized I accidentally flipped into lecture mode. My apologies, occupational hazard.
Well, thanks. And Rachel and Laura, thank you very much for your presentation on what really underscores the importance of measuring perception, and that it does matter, and it matters that you take that into account. And I had a question. Here in the States, I think we heard fairly endlessly how out of control the COVID situation was in Brazil. And that was not being managed. It was crazy. You know, the leader was crazy. Nothing was going right down there. Did you guys find any of that reflected in your survey? I mean, do the Brazilians themselves, did they feel that way? Or was it just how it was being reported here in the US?
Yeah, we definitely heard that from students. We did a live chat with our students, spoke with their students about, you know, how they felt about how our political leaders were, you know, utilizing risk communication. And we were definitely hearing that reflected from the students, their disenchantment with, you know, lack of messages about using personal protective equipment in Brazil. When we saw, you know, the mask usage, the preventive measures, that wasn't quite reflected in our data because there was this skew towards highly educated students in the healthcare fields from both countries. And I'm sure Rachel might agree with that. But we certainly, when we had the live discussion, it certainly contextualized, you know, where the perception of these students was coming from. And we also saw disenchantment with students from the US side about some of the larger messages from leadership, and not just on the state level, on the, you know, federal level. So that's what makes it interesting in terms of being able to really have an online live discussion with the other group, the other cohort, to put all of this in context and to really learn from it. And we, you know, I don't know what number wave, unfortunately, this region of Brazil is in terms of the pandemic. I'm hoping things have started to calm down, but there are going to be so many challenges with access to vaccines and sort of moving forward. That whole cohort, and that may be reflected if we do the second survey this summer and have another module. So, and Rachel, feel free to jump in.
Yeah, I think it's definitely, we were able to see in some of our variables too, whether they agree with their region or city's policies. I mean, it was overwhelmingly where the Brazil students did not agree. They had a very small percentage, only 15% did agree, where with the US, we definitely had a higher percentage. I think it was a little bit over 50% of agreeing. And then also that was a follow-up question of why, and you can kind of see some of those reasons in there of their leadership and things that they didn't agree with. So it was very interesting to see their perspective, especially compared to US, and kind of also where the overlap lied.
And I also just want to quickly comment, it's really informative to hear the different research and advocacy of the different panelists, because that's where our students are coming from New York State mostly. So we can, you know, better understand their experiences and the different challenges around them as they head to the graduate level. So I very much appreciate hearing from all the panelists today, and congratulations on the passing of the legislation.
Well, thank you guys all very much. We had some internal discussions here about how incredibly diverse we thought this panel was. And, you know, sitting here and hearing your presentations and following up, there's so much overlap. It's really remarkable. A lot of fun, made it very interesting for me, hope for you as well. And just want to say thank you again so much for your time and your input here. I think this is great.
Thank you. Thank you very much, Brian.
You bet.
Thank you.
Thank you, everybody.
Thank you. Thank you, everyone.
Thank you, everyone.
Thank
Bye.
you. Bye.